Let's see the comparison of manifestations of the genito-ulcerative diseases. Genito-ulcerative disease is a sexually transmitted infection in which there are genital ulcers. Okay. So example of genito-ulcerative disease are syphilis, genital herpes, chancroid, LGV, that is lymphogranuloma venereum, and donovanosis. See, syphilis is caused by Treponema pallidum. Genital herpes, it is caused by a virus, that is herpes simplex virus. Chancroid is caused by Haemophilus ducrei. LGV, that is lymphogranuloma venereum, is caused by Chlamydia trachomatis. Chlamydia trachomatis causes LGV, and donovanosis is caused by Klebsiella granulomatis. So first one, that is syphilis caused by Treponema pallidum. Incubation period is 9 to 90 days. 9 to 90 days. The genital ulcer will be painless. It will be single and indurated. The lymphadenopathy will also be painless. It will be non-indurated and bilateral. See, the ulcer will be single, lymphadenopathy will be bilateral. The ulcer will be indurated, lymphadenopathy will be non-indurated, that is foam. And the treatment is penicillin single dose. Okay. So ulcer is painless, single, indurated, lymphadenopathy is painless, bilateral and non-indurated, that is foam lymphadenopathy. Genital herpes, incubation period is 2 to 7 days. The genital ulcer will be painful. It will be multiple, bilateral, and there will be tiny vesicular ulcers. The ulcers will be painful, multiple, bilateral, tiny vesicular ulcers. So see the difference. सिफिलिस के केस में पेनलेस था, हर्पीस के केस में पेनफुल है. सिफिलिस के केस में सिंगल था, हर्पीस के केस में मल्टीपल है, और herpes के केस में bilateral tiny vesicular ulcers are formed. Lymphadenopathy is also painful. It is formed often bilateral with initial episode. And the treatment is acyclovir for 7 to 14 days. See, genital herpes के केस में the genital ulcer will be painful. It will be multiple in number, bilateral, and tiny vesicular ulcers are formed. Lymphadenopathy is also painful. It's formed and it's often bilateral with initial episode. Treatment of genital herpes is acyclovir 7 to 14 days. Chancroid, the incubation period is 1 to 14 days. Chancroid is caused by Haemophilus ducrei. In this case, the ulcer will be painful, soft, usually multiple, it's purulent and it will bleed easily. Chancroid का जो ulcer होता है, it will bleed easily. It's purulent, it's soft, usually multiple and it's painful. ठीक है? And the lymphadenopathy is also painful. It's soft, there is marked swelling which leads to bubo formation and it's unilateral. In case of chancroid, the lymphadenopathy is unilateral and the drug of choice is, the treatment is azithromycin single dose. Chancroid is caused by a bacteria, Haemophilus ducrei. The treatment is azithromycin single dose. Incubation period 1 to 14 days. The ulcers will be painful, soft, it will be bleed easily, it's usually multiple and purulent. Chancroid के ulcers are painful, they will bleed easily, they are soft and purulent. Lymphadenopathy is also painful, it's soft, there is marked swelling causing bubo formation and it's unilateral. सिफिलिस के केस में भी lymphadenopathy was bilateral, genital herpes में भी it was bilateral, chancroid में it is unilateral. Then LGV, that is lymphogranuloma venereum caused by Chlamydia trachomatis. The incubation period is 3 days to 6 weeks. It There is a huge range, that is from 3 days to 6 week. The ulcer will be painless, it will be firm, and a single lesion will be there. In case of LGV, the ulcer is painless, it will be firm and single lesion. Lymph adenopathy is painful and soft, it is unilateral, and the drug of choice for LGV is doxycycline, 21 days. LGV incubation period 3 days to 6 week. The ulcer will be painless, but lymph adenopathy will be painful. Okay, ulcer will be painless, lymph adenopathy will be painful. The ulcer will be painless, it will be firm and a single lesion. Lymph adenopathy will be painful, soft and unilateral. ठीक है, जैसे सिफिलिस में दोनों चीज़ पेनलेस था, जेनाइटल हर्पिस में दोनों पेनफुल था, शैनक्रोइड में भी दोनों पेनफुल था, बट एलजीवी में जो अल्सर होता है वो पेनलेस होता है और लिम्फ एडिनोपैथी पेनफुल होता है और यूनिलैटरल होता है. ड्रग ऑफ चॉइस इज doxycycline, 21 days. Then donovanosis. Donovanosis is caused by Klebsiella granulomatis. The incubation period is 1 to 4 weeks. It could be up to 4 months. It could be up to 6 months. ऐसे incubation period is 1 to 4 weeks. It could be up to 6 months. The ulcer will be painless, single or multiple, beefy red ulcer which bleeds readily. So ulcer will be painless, it will be beefy red in color, and it will bleed easily. It could be single or multiple. डोनोवानोसिस के केस में अल्सर पेनलेस होता है, इट कुड बी सिंगल और मल्टीपल, एंड इट विल ब्लीड ईजली. इट इज़ बीफी रेड इन कलर. Lymph adenopathy is absent. Pseudobubo may be present due to subcutaneous swelling. ठीक है, ब्यूबो फॉर्मेशन किसके केस में होता है? ब्यूबो फॉर्मेशन होता है शैनक्रोइड के केस में, और डोनोवानोसिस के केस में pseudobubo may be formed due to subcutaneous swelling, and the treatment is azithromycin. ठीक है, सिफिलिस का ट्रीटमेंट था पेनिसिलिन. जेनाइटल हर्पीस एक वायरस है तो इसका ट्रीटमेंट है एसाइक्लोविर. शैनक्रोइड का और डोनोवानोसिस का एजिथ्रोमाइसिन इज़ द ट्रीटमेंट. एलजीवी के केस में डॉक्सीसाइक्लिन. दिस इज़ द शैंकर ऑफ प्राइमरी सिफिलिस. दिस इज़ द हार्ट शैंकर. प्राइमरी सिफिलिस और हार्ट शैंकर, इट इज़ कैरेक्टराइज्ड बाय सिंगल पेनलेस indurated, hard indurated ulcer. Common site penis in males, cervix or labia in female. This is the painful ulcer of chancroid. The ulcer is usually multiple, okay, and it's soft. It will be soft, it will bleed easily, and it's purulent. So this is the chancroid ulcer. It is painful and it is usually multiple. It is soft, so it will bleed easily, and it is purulent. This is the ulcer of donovanosis. The ulcer will be beefy red in color, and it will also bleed easily, and it will be painless. Okay, donovanosis के केस में painless ulcer is there which is beefy red in color. And see, this is the Donovan bodies. These are the Donovan bodies.